are back now on the Hampton Roadshow. According to the Centers for Disease Control and Prevention, about 6 million children in the United States aged 4 to 17 have been diagnosed with attention deficit disorder. It is a common diagnosis that can affect each child differently, but it does require some treatment. Here now to discuss some of the ways to spot attention and focus issues and how to treat them is Dr. Rick Ellis from Spectrum Psychological. Thank you for being on the Hampton Roadshow.
Great to be here.
So I'm sure there are a lot of parents right now who are watching their children and wondering, is this ADD or ADHD?
Well, it could be a lot of different factors. There can be depression, anxiety, but we're looking for the symptoms such as being off task, difficulty with focusing, inattention, and there's the version with hyperactivity where the child are restless and moving around a lot. So we look at homework. How do they do getting their homework done? Does it take forever to get homework done? Does the teacher report being off task, too jumpy, too anxious, talking to other kids during class? So we look at those kinds of symptoms. We have computerized tests that we use to look at how well they can focus. We have checklists that the teachers and the parents complete, and we want to get a whole picture. We look at IQ, we look at achievement, we look at reading disabilities.
Right.
Might that be the actual reason for what appears to be the ADHD?
Yeah, I think it's important to let people know that it's something that needs to be thorough, that you need to talk to just about everybody who's interacting with your child on a daily basis, like you said, to get that complete picture. But once you're there, once you've got the picture and you've brought in the professionals, you've got a diagnosis, then parents are faced with the overwhelming options of treatment. And, you know, I know today we're not here to debate whether medication should be used, but you want to talk specifically about what you do, which is different.
Well, yeah, and I do recommend to parents to look at diet. You know, sugar is a big issue. Some advocate diets without red dyes in them, all those kind of things, all those different pieces. Behavior management, relaxation, mindful meditation, all those pieces we see as contributing to how we solve the problem.
Yeah.
But I was seeing so many kids on so many medications, and then you have another medication for the side effect of the ADD medication. So because the diet's a problem. Some kids won't eat lunch, they won't eat dinner, 8:30 at night they'll be famished. Sometimes there'll be a rebound effect after the medication wears off where the attention is even worse. So we look at
what is neurotherapy?
What else can we do?
Yeah.
So I looked around to see what can we do besides all this medication, and thought, well, neurofeedback has been used with ADHD children for 45 years.
Okay.
And the early versions of it, if someone was at a university, they had a controlled group they worked with, they saw some great results, but I really didn't see kids that had tried it come back and say it really, really helped them. And I looked into it, figured with computer technology things would be improving, and why haven't I heard about it?
Right.
And I looked, and now we do what's called a QEEG. We, just like an EEG in the hospital, but we're not looking for tumors or damage or seizures. We take a map of those squiggly lines and come up with where in the brain the dysregulation is. And we take that information and develop a customized plan for that individual child. Is it more hyper? Is it more inattention? Is it more distractible? And we find out what we need to do, and we come up with a plan, and the kids, basically the main part of the program is they'll watch a movie fade in and out.
Yeah, so this is not invasive, it's not painful for the child. In some cases, if they get to watch a movie while this is going on, they may even find it fun. More than we could ever cover in one interview, so I hope you will come back.
Sure.
In the meantime, if you'd like to learn more about neurotherapy, this QEEG, the neurofeedback, you can get in touch with Dr. Rick Ellis. He's at Spectrum Psychological and Neurotherapy. They're at 4542 Bonnie Road, Suite B in Virginia Beach, 757-640-1882, or you can do some research online, spectrumpsychological.net.